Acne is the most common skin disorder. It can begin in the early teen years and it can last into adulthood. Dr. Fromm from Fromm Dermatology has some words of wisdom for those dealing with this skin condition. Good morning. Today we are here with Dr. Linda Fromm from Fromm Dermatology to talk about some skincare essentials. Good morning, Dr. Fromm.
Good morning.
Now let's talk about acne, some of the basics. What causes acne and when should people come in kind of before it's too late?
Acne is kind of multifactorial, so it's a combination of overactive sebaceous glands or oil glands and hormones with a minor role of bacteria. We used to think in the past that bacteria played a pretty significant role, and now we've learned from studying it over the years that we don't think that that has a predominant role. There are a couple of dietary things, dairy being number one. There is no question that dairy will worsen acne, so that is huge. I see some teenage boys that are drinking a gallon or more of milk, and if you are struggling with acne, I recommend you cut out milk entirely and even limit cheese and yogurt as well. The other thing that has been documented to be associated with acne is just high glycemic index, so basically junk food.
Obviously, if it's not good for your body, it's not good for your skin.
Exactly.
So when should a patient come in? You know, let's say we have a couple blemishes here and there, but when is it time to see a professional?
Right, that's a good question. So there are some great over-the-counter acne topicals out there that I recommend on a daily basis to my patients. They take time. It's important to understand that it really takes 2 to 3 months of nightly use of these medications to really see what they can do. However, if you have a son or a daughter that has cystic acne that is scarring, I recommend not delaying at all and scheduling an appointment with a board-certified dermatologist.
With school in session now, a lot of kids are, maybe taking gym, going back to class. That sweat on their face, does that have any effect?
It can worsen it. I do recommend for my student athletes, they can, after some sporting events, they're just pushed right onto a bus. But usually they can have a few minutes. They might not have time for a full shower, but just to wash their face with a mild cleanser. Something over the counter that I recommend all the time is Vanna Cream. They make both a bar soap and a liquid cleanser that we really like, that is non-irritating and mild and won't dry them out. So some of the state-of-the-art acne topicals are now over the counter, but there's a lot that patients can find at Target and Walmart and their pharmacies.
And Dr. Fromm also recommends using a moisturizer after cleansing your face, especially in the cold, dry weather conditions.